welcome to everybody, including members of the public who've joined us for this. It's an unusual board meeting, but it's also a very signal board meeting because this is the inauguration of the Essex Integrated Care Board, covering for the first time in one organisation the whole of Essex. And I think I first of all want to thank everybody who's got us here for the incredible hard work that has involved. And that is, of course, by definition, given that we've had to meet NHS requirements for our operating costs, that's a thanks to colleagues who are still working with us and taking the new organisation forward, and colleagues that we've had to say goodbye to. A lot of those colleagues haven't given many, many years of service to the NHS, for which we're grateful. And actually, frankly, whether or not, colleagues were carrying on or not, they have all worked tirelessly to get us to this point, because a lot of effort had to go in to getting us so that we could be up and running as required today. So, thanks to everyone, and fare you well to those colleagues that we have said goodbye to. Today will be an unusual board meeting. Whether you've been in the public attending one of our meetings, or in previous incarnations of one or other of the three ICBs and their board meetings. Usually our board meetings are really quite discursive. We often have problems to solve. We have policies to agree or not on. We have to get down to what I like to think of as brass tacks. Today is much more mechanical because we cannot exist as an organisation without appropriate sort of policies and so on in the bank, so that we can conduct ourselves appropriately. Everything that is there today has been put together by colleagues using the best we could find of the equivalent policies or procedures or whatever within the three ICBs that have kind of come together to make the new Essex ICB. So we've unashamedly plagiarized, stolen the best to make our new documentation. And they have been looked at, scrutinized line by line in a number of fora. And today I'm conscious that in the time we've got, there is no way that we are going to be able to sort of go through these in detail, because it's hundreds and hundreds of pages. So an unusual board meeting for us, but it's absolutely vital to get us up and running. Our next board meeting, which I think is April the 23rd, we shall be back to our normal, very much discursive self. So I wanted to say that as a preliminary, because if you haven't attended a board meeting before, you might think, well, I'm really not taking this activity seriously. I can promise you we do. But today is much more about those mechanics, I'll say again, of getting up and running. So welcome to people. I haven't got time to go around and introduce people. I'm conscious there are new board members attending for the first time and so on. It's kind of almost rude, but I've got to just deal with the mechanics because there's so much the team has to get done, never mind our part in it today, in order that we get up and running. So without further ado, Tom, I'm going to ask if you or Michael would just guide us through the agenda. I have only one screen here, so it's quite hard for me to keep an eye on both things. So if you can just guide us through. And I'm looking actually for, given that we have really looked in different for these papers, I'm looking really to sort of move quite rapidly through the papers, consistent with doing the job properly.
Yes, of course, Mike, and good morning, everyone. So I'll kind of steer through the agenda. As Mike has said, clearly this is very much kind of procedural in many ways in terms of this is the first day of the new ICB, but equally, as Mike says, this is very important and is built on the work of many months in terms of making sure that we are setting up an organisation that's fit for purpose and able to do its duty and meet its statutory obligations. I think it's just important to note, just before we get into the detail of it, before this meeting, we did hold the appointments panel. That is the panel that meets in order to confirm the board members of the new organisation, and we have completed that process and have confirmed the appointments to the new board. That includes executive, non-executive, and partner members. And then moving forward in terms of the agenda, we've got the standing kind of item around the register of interest for board members. I'm not intending to go through that in any detail. And so the first substantive item is item 3 on the agenda, which is the Essex ICB governance framework. I don't know, Michael, do you want to just say a few words around that bit?
Of course. Good morning, everyone. Just to reiterate, as both Mike and Tom have said, these are all documents that have been through the Essex Joint Committee previously, or some other form of joint governance, and they are the kind of the key pillars of the governance framework that we need to, as we move into the Essex ICB. Approval is sought for the constitution and standing orders, scheme of reservation, delegation, and associated documents, the establishment of the subcommittees of the board, finalisation of the governance handbook, and the approval of the assignment of lead roles.
So I'll pause there to see if there's any questions, Mike, from board members. Are you on mute, Mike?
The day's going really well so far. Any questions or comments from anybody? Okay, thank you very much. So we asked to approve those, yes?
Correct.
Okay, and board, I'm assuming it's the usual rules even when we're online, which is silence is definite approval. So thank you. So the next item, Tom.
Yes, of course. So the next item is delegation agreements. And so, Michael, again, over to you.
Yeah, so these are the delegation agreements which exist between which will exist between Essex ICB and NHS England that cover a range of areas, so specialised services and primary care, including general practice, pharmacy, optometry, and dental. They are a transfer of existing arrangements over to the ICB, and again, we're asking for them to be approved today.
Thank you. And Michael, this is nothing, so to speak, that we haven't done before. Correct. It's just that the body in which those powers are vested is changing, and we need to approve that. We are happy to take that on. Yeah. So everyone happy with that? Yes. Yep. Thank you. Good. Excellent. Next one then, Tom.
Excellent. Is the adoption of Essex ICB policies. And so within the papers that have been shared, we have set out the range of policies for adoption by the Essex ICB, and also have noted that a number of those policies will form part of the ICB's governance handbook. These policies have gone through engagement and discussion through the joint committee arrangements that we've had in place across the 3 ICBs in the lead up to today, and have been supported by them. But obviously, they need to be formally ratified and adopted by this new board.
And I, for one, certainly have dragged through all the hundreds of pages because it's hard work. But I'm so grateful to colleagues who put it together. And these, again, the policies have quite deliberately taken the best of the 3 constituent ICBs that came together to form this one. So are you happy that we approve and adopt those policies? Thank you. Tom?
Thank you. The next item, item 6, Mike, is the appointment of the founder member of the Essex Integrated Care Partnership and for approval of the Integrated Care Partnership terms of reference. And so colleagues will know that despite the changes which have happened to ICBs, there's still some legislative changes that are still anticipated around the future role of ICBs. And so one of the things that was considered and discussed last summer when we were talking about the changes was the future of integrated care partnerships. However, integrated care partnerships do remain a statutory requirement, and there would need to be legislative change for an ICP, for ICBs not to have an ICP of some form. So we are required to have one. And so this is effectively making sure that we comply with our duties to have one, and that Mike, you as chair of the ICB would be the founder member of the ICP, and obviously we have the associated terms of reference. We've got an opportunity, I think, to think about how we might want to use the ICP over the course of this year, particularly about how it will work, how the opportunities of it working with local authority colleagues in particular, and particularly obviously in light of local government reform and the announcements which have been made. They will be matters for discussion over the course of the coming kind of weeks and months, as opposed for discussion today. But this is just so we can make sure that we've got the ICP constituted, we've got the founder member in place, and so we're compliant with that element of the duties that are placed on us as an organisation.
Thanks, Tom. So, I mean, you're saying that actually, I mean, just legislation apart, we will continue, and indeed the direction of travel that we've been given by the government through the NHS, it involves ever closer working with partners, whether they're in local government, whether they're in the voluntary community or faith sector, wherever they are, and one of the vehicles is an ICP or something like it, and in the context as well of local government reorganisation, where we've got to work in harmony with local government colleagues. That's why we have to have our thinking caps on, so that we make sure that every pound, wherever it's spent, is best spent to support the health of the population, health and care of the population that we're here to serve. So this again is a mechanic, but we're enthusiastic for finding the right vehicle for the conversations that we have had traditionally in the integrated care partnership, but that will need to change given the new infrastructure that we're required to have in place. So people are happy to
just jump in. Sorry, can I just jump?
Yeah, please do.
So
is that you're on a small screen? Is it Rob?
Yeah, sorry.
Yeah,
it's Rob Thursday here from Thorough.
Yeah.
So just very quick, I know not for discussion today, but conscious of the potential size and scale of that ICB partnership moving forward, would it be possible when we do bring it for discussion to look at actually what the options are within the statutory framework? So are there a number of different options for trying to make sure that we keep that of a size and a scale where it can still be meaningful, but it gets everybody together? Will there be different options that can be considered?
We can totally pick that up, Rob.
Yeah.
I think there's a question in terms of there's been a long running question about the role of health and wellbeing boards versus the role of health ICPs, isn't there? And so I think, well, let's get into that conversation. I think as part of the LGR dialogue that we're going to be having, I think we can work through what's the right mechanism for working together at the right scale, but we'll take that away as an action again.
Yeah, it's a very good point. We don't want a lecture hall full of 400 people, because we need to engage with each other, don't we, on issues, and we need to work closely with partners. So thanks for raising it, but it's a good point. Thank you, Rob. So with that said, happy to then approve. Yes, thank you. Tom, next one.
Item 7 is the Population Health Improvement Plan, and Beverly, I think you're just going to say a few words on this one before we move to approval and decision on this one.
So yes, I am. The board has seen this plan previously, and we've had a number of conversations at the Joint Committee about the plan. This is the Health Improvement Plan as statutorily required for the ICB to have in place. There have been no changes since the version that we discussed previously, with the exception of a couple of typos that have been picked up and amended, and this will now be published on our website during the next few months, and we will be developing and implementing the implementation plan to deliver the work which is in this plan, which is, I guess, the kind of most important bit. And we will be reviewing some of the sections of the plan to reflect the fact, for example, that the neighbourhood health guidance has now come out, so we can be clearer on some of our planned outcomes and timelines. So this will be a kind of living, walking, breathing document for the board over the coming years. That was all I was going to say.
Thank you, Beverly. And when you say typos, does that include the couple of numerical errors?
Yes,
that Dr. Davies
it does. Yeah.
Pointed out. Okay, just to so that we're trading, so to speak, in good faith. That was raised at that.
Yeah. So one of the typos was a numerical error, and the other one was around a definition.
Great, lovely. All right, that's good. Thank you. I mean, and again, it's an incredible document. The prospect of implementing it all is, I would say, somewhat scary. And we've got to make sure that we do deliver, and that we, bite it off in consumable chunks to get it done. But I think it's a document that reads very well and addresses the issues, and it's had a lot of exposure, including with council partners. So happy to adopt. Thank you. Tom?
We're now on to any other business, Mike. So that was all the core business that we needed to get conducted.
Thank you. Okay, well, I mean, I thank everybody again for putting things together so that our ducks truly were in a row and we could get this done for the time that's required. And I look forward to seeing everybody, so to speak, back to normal for an ICB board meeting, round the table where we've got things to talk about and sort out. So thanks to everybody for your attendance today. Some of us, I think, have more formalities to proceed with, and I'm happy to proceed straight away, Tom, if we can have everybody around so to do.
Yes, of course, Mike. I think the next meeting is specifically for non-executive directors, and so you'll be able to join on that link once we finish this meeting.
Okay, well, thanks to everybody. Thanks to members of the public who've joined us to mark this auspicious occasion. I think it is good news that we have one integrated care board for Essex. It gives us all sorts of further options to resolve issues, difficulties, and actually also licenses us to be more ambitious. So that's good news for all. Thanks, everybody. Have a good rest of your day if you're not continuing further with these calls. Thank you. Bye-bye.